A very good morning to all of my dear friends। हाँ, लेकिन देखने से तो नाइट जैसा लग रहा है। अरे वीडियो तो मॉर्निंग में ही ना आएगा। Okay, so now we focus on study. Today I am going to discuss a topic of community medicine, and the name of topic we can see that epidemiology. हाँ, लेकिन in this class we are now going to discuss about the epidemiology. In this class I am going to discuss the epidemiological classification। हाँ, तो आप epidemiology क्यों लिखे हुए हैं? अरे नेक्स्ट वीडियो में आएगा। Okay, it's fine. So now we are going to discuss the epidemiological classification. So on the board you can see that this epidemiological classification is major categorized into the two categories. One is the observational study and the another is experimental study. Okay, so first we try to understand what is the meaning of this observational study and the interventional study. This interventional study are also called experimental study. Why we called it experimental study? Because here researcher are going to going for experiment. They basically do an experiment on research, not for a research. They are doing experiment on patient or any they also do experiment in normal or generalized population. So that's not matter. So this observational study are the further divided into the two subcategories. One is the descriptive study and the another is analytical study. But I am forget to discuss about the observational study and the experimental study difference. I already told you that first we try to discuss the difference between observational and interventional study. I am really very sorry. Okay, so we start the topic with what is the difference between the observational study and the experimental study. So according to the word observational means here researcher only observe the things. Now researcher only observe the progression of any disease. They basically go to any hospital wards, stand in front of patient bed and try to observe the progression of disease without any doing interfere by themselves. But in case of the experimental study, here they are interfering of researcher for the progress to study the progression of a disease. Basically what happens in case of experimental study, here researcher giving some medication to the patient or any generalized population and try to observe the progression of disease, but no such things are done in case of observational study. In observational study, researcher only observe the progression of disease without doing any interfering by themselves or from itself. Whatever I'm weak in English language, I'm trying to improve it. Okay, it's fine. So then this is the one of the common difference between the observational study and experimental study. This observational study is further subcategorized into the descriptive study and the analytical study. Okay, so what is the difference between this descriptive observational study and analytical study? So when we focusing on what analysis means, when we going for the analysis, we basically analyze the things when there are two separate groups. So basically this analytical study, there are two separate groups and researcher try to study the progression of disease in by making two separate groups. But in descriptive study, no any separate groups are made by the researcher. They only observe the a large population and record the data. The another things in case of descriptive study, researcher only study the distribution of the disease, but in case of analytical study, researcher study both distribution and the determinants of the disease. Okay, so what is the meaning of this distribution and the determinants? Distribution means where the disease occurs, whom are affected by the disease, and what three things basically comes under the descriptive study. When the disease occur, that is at which time the disease occur, where the disease occur means what are the place where the disease occur, and the four things are whom are affected by the disease. मतलब more ladies are affected, which age groups people are affected by this disease more. So in case of a descriptive study, researcher focus on three things: where the disease occur, whom are the affected by the disease, and when the disease occur, that is what is the time when the disease occur. But in the case of analytical study, researcher study distribution along with determinants, means here researcher study when, where, and whom. Along with they also study how and why, means how the disease occur, why the disease occur. So this is the collective study of the epidemiology. The third difference is in case of descriptive study, since the researcher study only the distribution of disease, they not study the determinants of the disease. So it is in this descriptive study, researcher only generate the hypothesis, they not prove the hypothesis. But in case of analytical study, researcher generate the hypothesis and try to prove the hypothesis. What is the meaning of this generate the hypothesis and prove the hypothesis? We understand it by taking an example. Let's suppose let's suppose I am a researcher and I am go to East Point Medical College where I am study. So when I am going to the East Point Medical College and see patients, and I write I see that there are so many patients having clinical symptoms of the constipation, abdominal pains, facial pallors, and some of them develop wrist drops, foot drops. So I first see what are the symptoms of the patient. Then after seeing these symptoms, I go for the suspicious diagnosis, not a probable diagnosis. According to these symptoms, I think that patient may have this disease. Let's suppose I think that patient may have lead poisoning. So here the researcher are not go for the confirmatory diagnosis. So since the researcher are not goes for the confirmatory diagnosis, so it is considered as a hypothesis. But in case of analytical study, the researcher try to prove this hypothesis. They try to prove that whatever the symptoms that I see, whatever the symptoms that the researchers see, is this symptoms is classical for this disease or not. If this symptoms is classical for this disease, then it is the scientifically evidence, then it is not considered under the hypothesis, then it is proof that whatever the patient having the disease. So basically what I am trying to say, in case of descriptive study, researcher generate the hypothesis, while in case of analytical study, researcher generate as well as prove the try to prove the hypothesis. So within 5 minutes I try to explain what are the overall difference between the descriptive and the analytical study. But if you want that to explain this difference in one words, then we go for this descriptive study is a non-comparable study, while analytical study is the comparative study. In descriptive study, we take a general population, we no go for the separation of groups. But in case of analytical study, we first separate the peoples into the two groups and then we go for the study. So in simple word, we can say that it is non-comparable study or non-comparative study, and the analytical study is the comparative study. Okay, so now we are going to discuss this part, ये वाला part, This part is discussed in next video. So we start the topic with case report. What is the meaning of case report? Let's say case reports is already they comes under the observational and the descriptive study. So obviously they follow the whatever the headlines or the points of observational study and the descriptive study. So what are the difference between this case report from the other series? In case report we basically researcher a study on single patient. So what are the specific feature of this case report? There is observational study done on a single patient. So when we do observational study in a single patient, it is called case reports. What is the meaning of this case series? Case series means when we study observational analytical study, basically now in observational they comes under the not analytical, descriptive study. So when we study observational descriptive study in a group of patient, when we study observational descriptive study in a group of peoples, then it is called case series. What about case report? In case report we study observational descriptive study in one patient, but when we study observational descriptive study in a population or a group of patient, then it is called case series. For example, if I am going to the East Point Medical College and I take one single patient and try to find its diagnosis on the basis of its symptoms, not confirmatory diagnosis, only क्या probable diagnosis or it might be some क्या उसको बोल सकते हैं यार generation of the hypothesis. So if I am going in this Point Medical College and take a single patient and try to write the hypothesis, then it comes under the case report. But when I am going in East Point Medical College and take so many patients having the same clinical features, then it comes under the case series. After discussing the case report and case series, we go for the cross-sectional and ecological study. Now here we can say that I can write this cross-sectional study and the ecological study in both descriptive parts as well as the analytical part. So what are its meaning? Basically it means that ecological study and the cross-sectional study, it is depend on the mind of researcher. Now how researcher are going for a study. If researcher making a groups and then it is go for a study, then it comes under analytical study. But when researcher are going for a study without making any groups, then it comes under descriptive study. Okay जी, ठीक है. So what is the cross-sectional study? In cross-sectional study we basically try to find the prevalence of disease. For example, if I am going in any village and in village I am collecting so many peoples and we ask question, for example, how many of them having the anemia. So at present moments, how many the people saying that I having anemia, we record the data. Then these types of study is examples of cross-sectional study. In cross-sectional study, we basically ask the question of exposure and disease at the same times. So these are basically all about the cross-sectional study. In ecological study, what we do? In ecological study, we basically comparing the data. So how on the basis of comparison of data we can differentiate this ecological study is the descriptive or the analytical study. Let's see. If I am collecting a data without any exposure or risk factor, if I am collecting a data without any exposure and risk factor, then it comes under descriptive study. But if I am collecting the data with exposure or risk factor, then it comes under the analytical study. Explain it with example. Obviously, for example, I am saying that CTA having a more anemia than CTB. So here we only comparing the data that CTA having a higher anemia than CTB. There is no any here we not include any exposure or the risk factors. But if I am saying that CTA having a higher lead exposure, so CTA having a higher prevalence of anemia as compared to the CTB. So here we include both exposure and disease. So when we comparing the data with by including both exposure and disease, then it comes under what? Analytical study. And when we only comparing the data without any excluding the risk factor, then it comes under what? Descriptive study. So this is all over about the observational descriptive study. In next video we are going to discuss the case control and cohorts. So okay, thank you.